Supreme Court has ruled to uphold the mandate, but they're doing so as a tax. Now, a lot of people are wondering what that means for them, Jacki. So tell me what that means and whether or not this harms the Affordable Care Act in any way, shape, or form.
No, actually it doesn't, and that's what the wonderful thing is about this, right? So what they said in the Affordable Care Act is that if you don't buy health insurance, that you're going to have to pay a penalty, and that's what the individual mandate was. And the idea is that everybody's in the healthcare system just by default. At some point in your life, you're going to have to use healthcare. It's just the nature of nature, frankly. So the idea was that everybody's got to pay into the system. It also helps to keep costs down because you have the pool that's larger, and then that way everybody's accommodated by having costs spread out over a larger population. So what they did is they said, according to the Commerce Clause, the mandate was unconstitutional, that Congress did not have the right to call it a mandate and regulate it under the Commerce Clause. Instead, what they turned around and said today is it can be a tax because Congress does have the right to levy taxes. And they say it's a system that the government's regulating through a tax. A very, very small tax.
I like that you emphasize that it's a small tax because, first of all, a lot of ultra-progressives will argue that this is not socialism, this is fascism. You're forcing the population of the United States to buy into private insurance. So tell me what happens to the people who decide they do not want to buy the private insurance. They do get taxed, but how much do they get taxed?
1%.
1%
of your income. And then in 2016, it goes up to 2.5%. But the idea is that you're at some point going to take advantage of the healthcare system, and why should I pay for your use of the healthcare system, or why should Desi and I have to pay for your use of the healthcare system? So you're going to contribute to the larger cost, and that way it's not going to be totally uncompensated care that somehow you have contributed to the healthcare system that we all participate in.
Now, Desi, there are obviously huge upsides to the Affordable Care Act. I think a lot of people have focused way too much on the mandate and haven't focused enough on all of the good things that the Affordable Care Act accomplishes. So what were your thoughts on the Obama administration proposing this legislation in the beginning? I mean, a lot of people thought that the Obama administration was being too weak by not offering a public option, but ultimately, would you say that this has opened a door for future healthcare reform that could be better?
Well, it could be very interesting to see how it plays out. I mean, as we know, the huge fight to get even this far along in healthcare legislation, you know, the first healthcare legislation really in 60, 70 years, essentially. The fight to get that done, I think most people, most progressives were shocked and very much dismayed that it seemed like the Obama administration was negotiating with themselves instead of actually saying, putting forth the best deal that they could possibly put forth, you know, go as far as they possibly could. They basically negotiated back to the position that they thought the Republicans would go for, which then provided the Republicans with all that room to cut it back further and further and further. And what I find most fascinating about this is the Republican reaction to the mandate, which was their idea in the first place. This was, you know, an idea that was created by the Heritage Foundation back when Hillary Clinton was trying to solve this problem back in 1992.
Well, it's also out there to protect corporate interests in insurance companies.
Well, sure, it's out there to protect the private insurance industry. So, you know, the idea that they are so screamingly against the idea of a mandate is so hypocritical, so completely contradictory to everything they held dear up until about, I don't know, 2006, 2007, is kind of insane.
It is insane, but it just gives you an idea of how far the country has shifted to the right, because what Hillary Clinton was trying to propose back in the day would not have passed in Congress today. It would have been considered too radical.
Right.
So I can understand why the Obama administration would want to keep the private insurance companies and not offer a public option. But Jacki, let's talk about the positives for a second.
Sure.
You know, let's refresh everyone's memory, because there's the whole issue of pre-existing conditions. There's the expansion of Medicaid. Tell us a little bit about that.
Okay, well, here's what's going on. First of all, the new insurance regulations will say that you can't deny anybody for pre-existing conditions. And I think it's something now like 122 million people can be considered to have a pre-existing condition, because frankly, if you sneezed once back in 1982, you have a pre-existing condition. I mean, it is such a broad definition, and the insurance industry is in charge of defining it. So that's going to be amazing that people can get coverage for pre-existing conditions. The second thing is that they're not going to be able to charge women more than they charge men.
Finally.
And gender rating is what it's called. And it's not just they charge us more than they charge men. It's something like if a man smokes and we don't smoke, we still get charged more, right? I mean, it's such disparity amongst men versus women. They're going to have to cover things like maternity care, which you say, okay, maybe it's a women's issue. Yeah, but it takes two to make a baby. So frankly, those are the kinds of things that are good for everybody, and especially for families, right? It's going to cover, we know now it's like 3.1 million young adults who are allowed to stay on their parents' health care plan under the age of 26. I have a coworker who's a freelancer who is able to be a freelancer because she stays on her parents' plan up until the age of 26, and that allows her to do what she'd like to do in the workplace and not necessarily be tied to one particular job at a time where she's figuring out what it is she wants to be when she grows up.
Well, and I also think that this is something that Republicans, the reason they fight also so hard against this is I think that they know that once Americans get a taste of what they will actually be receiving in benefits and in lowered costs from the American health, the ACA, that they're going to want to keep it. And they won't be able to repeal or replace or take out any of those components. I mean, as you guys have been talking about for ages now, when polled on the individual components, Americans love the individual components. They've just bought into that propaganda that the whole bill is bad, but it turns out, of course, that they like the provisions. So once they get these provisions, they're going to want to keep them.
Because it's $235 million of negative advertising, right? That's what it buys you.
It has an impact.
Right, and so it makes people believe that what they're calling, and I hate the word Obamacare. I will go on record and say that I hate that word. I think it's awful. I think it has a negative connotation no matter what you do. But they've been taught that the Affordable Care Act is Obamacare, and it has this connotation that it's this government takeover of healthcare, and they don't really know what's in it.
I actually want to go to President Obama's statement on the ruling. I think it was a good statement. Let's go to video number 3.
Today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. That's why, even though I knew it wouldn't be politically popular and resisted the idea when I ran for this office, we ultimately included a provision in the Affordable Care Act that people who can afford to buy health insurance should take the responsibility to do so. In fact, this idea has enjoyed support from members of both parties, including the current Republican nominee for president.
Oh,
I like that.
that was a great
Nice
zinger.
little
Great line.
Yeah, that was a great line. Let's go to the next video, number 4.
It should be pretty clear by now that I didn't do this because it was good politics. I did it because I believed it was good for the country. I did it because I believed it was good for the American people.
Do you think he's secretly gloating on the inside?
He has to be. He has to be.
So celebratory.
But he did a good job composing himself. I mean, of course, Obama, I think, is the perfect example of composure.
The bottom line is we've cracked the door open. There's a lot more that we can do, but this will certainly help.